everyone. Welcome to the Gothenburg Health Podcast. This is our second one that we're releasing to the public.
That's right.
Yep. I am Andrew Knauss. I'm the CFO here.
I'm Brady Beecham. I'm the Chief Medical Officer. And
I'm Kayla Knauss. I'm one of the family practice physicians here. We're going to clue you into all the things you need to know about women's health. Hopefully we'll learn a couple things.
Well, I know I certainly will.
Andrew, I think we should acknowledge at the outset that you have been less than 100% enthusiastic to host a women's health podcast.
Yeah, I really don't understand who's picking these topics. I mean, I appreciate you enlightening me on a little bit of the why. But I'm fully prepared. I am wearing a full ski mask, so these ladies can't see when my face turns red. I have an appointment with HR scheduled in the morning just in case, and I've scheduled a flower delivery for my wife. So I'm ready to dive into what I'm sure is going to be a fascinating topic of women's health.
Let's get started.
Let's do it.
Let's do it.
All right. Okay, so I thought we could kind of take this conversation sort of from what we call a life cycle approach, sort of starting with kind of recommendations at the beginning of life and then kind of moving forward as you know, because as our age changes, health kind of needs change. So, Dr. Knauss, tell us, you know, what do you think about women's health? How do you kind of conceptualize this? You do a lot of women's health. Talk to us about how you see it and how you understand it.
Yeah. So I think it's a big thing to talk to my patients just about the changes that they're going to experience as they get a little bit older. Puberty, I think, is probably under talked about. And kind of a taboo almost. I think we're getting a little bit better, but just kind of asking if they have questions of what they're going to experience, if they even know what they're going to experience, if they know what body parts they have. I mean, crazy enough, like I think we talk about our privates in quotes, and then nobody even talks about the words that we use with them. I think that's important. And so I like to discuss that. I will say starting at probably 2 or 3, when I talk about privates with the little kids, I even use the terminology just because I think normalizing that helps with care as well.
Mm-hmm. And just like understanding how we're made. I had a patient visit once, and it was a woman who was pregnant, and she was from another country, and I think it had really poor kind of basic biology education. And so I had showed her a picture of like, this is what the inside of your body looks like. And she came back like 2 weeks later with one of her friends, and she goes, I want you to show my friend that picture that you showed me. And I just thought, wow.
Yeah.
I think for some people, their bodies are just so mysterious and really don't know exactly how a lot of things work. So yeah, starting to talk with even young kids about, all right, here's the body you live in.
Yep. Kind of what to expect.
Well, tell us a little bit about kind of HPV vaccines and why we think those are important for women and children and people in general.
Yeah. So I couldn't tell you exactly when it came out. I know I was in middle school, high school area when it came out, but the HPV vaccine was one of the first vaccines that came out to help protect against cancer. Originally, it came out only for women. That has since been changed, and they actually recommend it for boys as well. But HPV is the leading cause of cervical cancer. And so getting people vaccinated well before they are to the stage of their life where they're having intercourse is important in helping prevent that. And so that's why when we talk about giving it at age 11, we want to do this before people have made that jump. And with the HPV vaccine, it is either a 2 or 3 shot series, depending on the age that you get it. But it's also been found to be one of the causes of head and neck cancer. So I think this is important when talking to boys about why they also need to get the HPV vaccine.
All right, Andrew, here's a pop quiz for you.
Oh, great.
Do viruses cause cancer?
Yes.
Yes. Some viruses can cause cancer. And I think we're going to talk about, like we just talked about the HPV vaccine. We're going to talk about pap smears here, I anticipate, coming up. But this is, I think, a really cool example of where women's health and understanding challenges to women is informed so much more in science, because cervical cancer for a lot of years was like a major leading cause of death in women, and we really didn't understand what caused it. But kind of through a long kind of research history and beginning like in the 70s and 80s, we really started to see this is a virus that causes cancer. And so by understanding something about women's health, we now were able to develop vaccines and just kind of understand like how we interact with all this other stuff in the world. And so, yeah, HPV vaccine, it's a vaccine against cancer, but it's also a sexually transmitted virus. And so that's why it kind of starts to come into some of this conversation about women's health also.
And genital warts helps protect against those. Nobody wants those.
Oh, that's true.
Yes. Funny story, actually, when I know.
Here we go.
They didn't know this was coming. So when I was in high school, I worked at the medical clinic in Cozad, and one of the doctors actually came out and showed me a picture of genital warts and was like, "Do you want these?" And I was like, "No." And he's like, "Get the vaccine." And so I actually went home, told my mom, and then I got the vaccine because I didn't want those.
You got it. Yeah.
I couldn't move my arm for like half a day, and it was totally worth it.
Not interesting. Well, yeah, like this HPV, there's like hundreds of viruses that are all like cousins, and they all do sort of like quacky things, including cancer, including genital warts. Wow, what a nice group of viruses they
I've
are.
heard of some family trees like that.
And the H in there stands for humans because they love us. They live with us. The other thing, we talk about all this kind of getting into reproductive health stuff, but also as we think just kind of young kids, it's all mental health and sort of screening for anxiety and depression, and that's just such a common theme. And this is where like women's health and men's health have so much in common, I think, for so many people. When we get into early adulthood, this is kind of when people start thinking again about kind of, all right, do I need to go have a pelvic exam or go see the gynecologist, and also the kind of conversations about birth control, things like this. And I think as family doctors, this is something we spend a lot of time discussing in clinic. And, I think my attitude at least is, to the extent that people can become pregnant when they want to and like under circumstances that work for them, that has huge implications on their life and on their family and all that. So I don't know, I think it's really something important that we do, and it's a big part of what we do. We talk about it a lot. I feel like in clinic it comes up a lot. Yes, would you agree?
I would agree.
This is kind of an interesting topic because like on social media, it's now all this conversation about hormonal birth control, and I think it kind of, in terms of our public experience of it, like a lot of people are on these medicines and have experience with them or have tried it, or, somebody in their family has. And I don't know, like they're very effective. I mean, at least what I quote in clinic, like if you have a long acting reversible birth control, that's probably as good as having your tubes tied in terms of kind of pregnancy prevention. And then like the hormones, I think, there's different combinations, and I don't know, but it's, it kind of comes down to those two hormones just in different combinations and forms and what works best, and I don't know. So they're not perfect answers, but definitely for preventing pregnancy, they're really helpful. But talk to us about some of the other reasons that people kind of might use birth control.
Yeah. So obviously, like we talked about, preventing pregnancy is one, but also just abnormalities in your cycle. So if you're having quite a bit of pain or heavy bleeding, those are also times that we can talk about being on birth control. Also, as you go through your teenage years, sometimes people will have acne, and so sometimes I've used OCPs for that if they failed some other lines as well. So I think there's other options that we can do with it. Obviously, all of these forms do not protect against STDs, and so I like to make that remark, whether you're getting on it because you have pain with menstruation or not. You should always wear a condom if you're having intercourse, just because you can't protect against STDs with any of the hormonal contraception.
That is true.
Yeah.
They're different mechanisms. When we talk about kind of this age group also, let's go back to HPV, because this is often a kind of conversation. When should I get a pap smear, and what is a pap smear? And the pap smear, it's now kind of a molecular test. They're not even really doing the pap smear exactly, but it's looking for these cells on the cervix which have been influenced by this HPV, the virus we talked about earlier, and makes the cells look kind of wacky. So when do you talk about kind of starting that, and what's the newest recommendation?
Yeah, so initially it was yearly, kind of recommended maybe after you started intercourse, but the new recommendations are starting at age 21. If you have a normal pap smear, then it's every 3 years until the age of 30. And then after the age of 30, you can do a pap smear with HPV testing, and if that is normal, it's actually good for every 5 years. So your pap smears do not have to be every year. What a pap smear is, so a pelvic exam is when you are in the stirrups, and we are taking a look at your female body parts. A pap smear is when we are using a brush to brush the end of your cervix and look for those cells. I think that's important to note the difference, because I think sometimes people think a pap smear is a pelvic exam. So those are two different things.
Definitely. Or we'll say to people, have you gotten this test? And they're kind of unsure. Mm-hmm. So that's always a good thing to clarify, like, is this a pap? Or you'll likely get a results in the mail, that kind of thing. And it should tell you when to do it. And then at some point we stop recommending it. And that's usually at 65, I think, is the new recommendation, and kind of depending on people's risk profile.
Yeah.
But in general, we think about that. The kind of next major life cycle or kind of milestone that really comes up in women's health is a lot about pregnancy and things around that. And this is a huge topic. It's a whole field of medicine, obstetrics and gynecology. I mean, there's a lot in there. But, just in terms of some of the general things about pregnancy care, I mean, we know that this is really important. It's a time when a lot of women end up getting health care, like, become pregnant and then go back at the doctor more than you thought. And then with your kids, you come all the time to the doctor. So there's this phase where you don't go to the doctor for a while, and then it's like, oh, welcome back. So talk to us just a little, kind of if somebody has a positive pregnancy test, what are some of the things they ought to think about next?
Yeah. So if the first time I'm seeing you is when you have a positive pregnancy test, we talk about making sure you're on a prenatal vitamin. Some people do come in for what they call preconception counseling. And I tell anyone, really, if you are in that age range of being able to conceive, being on a prenatal vitamin is a good thing. Really, those first 12 weeks is when a lot of baby is being formed. And so being on that vitamin during that time is important. But yeah, so if they come in and they have a positive pregnancy test, we talk about that. We kind of go through medications. There's a lot of medications that you can be on while you're pregnant. I just think it's important to talk about it with a doctor of what is safe and what is not. Obviously, nothing is 100%, but we can always go through those risks and benefits with being on those medications. And then talking about the healthy lifestyle and the healthy diet. It is good to keep moving while you're pregnant. Walking is great. If you were not exercising before, even going out for a walk every day is really good while you're pregnant. It helps throughout your pregnancy with helping with pain, but it helps recovery a lot if you can stay active while you're pregnant.
That's probably good advice in general.
It is.
Yeah, I feel like we covered a little bit of that with Craig last time.
Turns out we really don't have
The
much better advice
condition.
than eat healthy, exercise,
Absolutely,
get enough sleep, all that. Yeah, but I think the idea of kind of prenatal vitamins, definitely, if kind of pregnancy is a possibility, that's usually before people even know that they're pregnant. That's when those kind of the folic acid and things like that are the most helpful, helping that brain develop and do its little thing. Okay. Let's talk about, so we've talked about a lot of the things that we think of in clinic, and I would say that it's during those reproductive years that we end up seeing women a lot in clinic and for irregular bleeding and things like this. And then as we kind of move into later life, I think this is where we start to have a lot more convergence. I think that kind of experience of being a woman and that reproductive kind of changes. It influences a little bit how women experience chronic disease later on in their life and things like that. But there's some kind of specific things that we start to get into. So I think one question that I always kind of get from women who are sort of transitioning from that kind of mommy baby phase to a little bit later in life is what is menopause and how do I know, and things like that. And I think for us also, it's often a clinical diagnosis, which is sort of Yeah, if you think you're in menopause and I think you're in menopause, you probably are. Talk to us about, I don't know, kind of how you approach that diagnosis and just sort of some of those hormonal changes that sort of the puberty of middle age.
Yeah. So when you go through menopause, or when you're officially postmenopausal, that's usually once you haven't had a period for a year. So those people that still have a uterus, it's a lot easier. The people that don't, it makes it a little bit tougher.
Hard to base
Yes.
on a change that
Yes.
you are not planning to expect. Yeah. Mm-hmm.
But once you haven't had a period for a year is what we call postmenopausal. But as you get perimenopausal, I mean, this can last for 4 to 8 years, and you start having like changes in your period where you can go 1 or 2 or 3 months before having a period, and they're not as regular as they used to be. You can have changes in your mood. You can notice that you're not sleeping as well. You can get hot flashes. Those are usually kind of the onset that you're starting to go through that change.
And there are some blood tests that sometimes we do to try to
Yeah.
kind of get a little sense, but it is kind of clinical.
It can, and those can be hard, those blood tests, especially if they're on any hormonal contraception, because that can affect some of those numbers. So that always clouds it as well. It's also a little bit scary to say, hey, go off of it for a couple months and then let's check. Just cross your fingers, nothing happens in the meantime. So I think it is a harder thing for women to kind of decide if they're there or not.
Totally. And I think another big part of women's health over the last few decades has been this idea of hormone replacement therapy. And, you know, I think, again, it was sort of in the 70s, 80s, the idea was this is really great and there's probably no harm with it. And as your estrogen levels go down, let's just start replacing them, and you can kind of hold off menopause and things like that. But that's really kind of been questioned subsequently.
Mm-hmm. Yeah, so I think it's been a big pendulum swing. Like, I think it was like back then, like, yes, everyone should do it, and now it's like no one should, which I don't know that that's the answer either. I think there's a select group of women that I think it's good for, but I do think it comes with risks, and I think knowing those risks and talking with your doctor about them are important. And there's cardiovascular risk, there's cancer risks with them, so they're there, but I do think it can provide benefit for them in the select group.
And that's where I think it becomes kind of tricky. Like, my mother was diagnosed with a breast cancer after taking this. And it was kind of when there was this whole women's health study that came out, and they were starting to make these links. And I think that's when the pendulum really swung the other way, where it was like, don't take this at all. And, you know, now I think it's come back, and we see it with a lot of sort of men's health also, this idea of supplementing testosterone and replacing hormones. And, you know, these are kind of complicated things.
Yeah, I agree. It's definitely not a cookie cutter. Like, every patient is different. And I think taking the whole patient into perspective is important when making those decisions.
All right, Andrew, we're mentioning men and men's health. Do you want to jump in on this one? Are you
sure.
happy letting us run the conversation?
This sounds very
here?
complicated. I feel like for men, you know, we rarely go to the doctor, and we hope that first heart attack takes us to the grave, and we don't really have to mess with near as much as what you're talking about here. This sounds complicated, and it's all very foreign to me.
Well, you're learning a lot then.
Yes.
Yeah.
Well, I mean, I think it is true. I think for men, it is like they kind of present back to healthcare when they've got maybe not the heart attack that takes you to the grave, but, you know, when something goes wrong, just because there's not this socializing of like, show up every month when you're pregnant, and then bring your kids every 3 months, and you come with them, and you just kind of like, women end up just having so much more access to healthcare. And I think for men it is different. There's not as many routine screens that go on, and it's sort of like, okay, come find us when you need us.
Right. Yeah. Yeah. And I think for those reasons you just said, I mean, you probably don't really start, most people don't really start developing a relationship. Most men don't until you've had probably a major health event. And then you're probably kind of behind the 8 ball at that point, and you're playing catch up. So, yeah, I don't know.
Well, there's even discussion about, I always think this is really interesting, where they say married men live longer than single men. And they say part of the reason for that is because they've got women saying, that looks weird, you need to go to the doctor, you need to go get that checked out. Like, no, that's not normal. I don't know if that totally explains it, but just I think there is a different access to healthcare for men and women, and having somebody in your life is like no, not normal. Men need that, right?
Absolutely.
My wife tells me I'm not normal all the time. I can relate to this.
Oh man. So as women start to get into kind of 65 plus and different things, we start thinking about some other screening tests. And this is where we're sort of trying to set people up for a healthy second part of their life. So one of them is mammograms. And so definitely breast cancer is a leading cancer in women. I mean, men have breast tissue and can have breast cancer also, but women are definitely where you see it. And so that's why there's some screening programs out there. So talk to us about mammograms and what you recommend for breast cancer screening.
Yeah. So mammograms, I still recommend starting at age 40. And that screening, it was always 40 and yearly after that. Then there was kind of a shift to maybe we can wait till 50 in a select population, maybe every 2 years. I really kind of stick to starting at age 40 and going yearly. I'll compromise if people want to go every other year. But I think mammograms are important. I think the sooner you can detect it, obviously the less invasive treatment that you need.
Yeah. And breast cancer death rates have really gone down.
Yeah.
And they say that's early detection plus better treatment. And yeah, I think your point about there's some different screening recommendations, I think sometimes that can discourage people because they're like, oh, they don't know what they're talking about, or this group says this. But I think, there's some different professional organizations that give recommendations. But in general, doing something is definitely better than doing nothing. And yeah, I think, this is one where you can kind of talk to your doctor in that 40 to 50 age group. But yeah, getting a baseline mammogram sort of in your 40s, definitely it seems to be that's where people are sort of centering around. Okay, we also bone density, we think that estrogen and pregnancy have some sort of long-term effect on bone density, and this is why we see osteoporosis a little bit more in women, and then do some screening for that. So that is our DEXA. Talk to us about DEXA, Dr. Knauss.
So if you have some risk factors, whether that's family history of osteoporosis or like early menopause, I believe too, but there's some certain risk factors, we recommend it before. But if you have not had a DEXA by 65, I usually talk to all my women at that age of getting a DEXA scan just to screen for osteoporosis. If you have osteoporosis or osteopenia, then sometimes we do repeat ones. There's medications out there that can help prevent or help with the progression of osteoporosis. But this is important because we know that if somebody falls and they break a hip, your mortality is pretty high with that as you get older too. And so that's what we're really trying to prevent, is we want people to live longer, but also to be able to be healthy and active as they're living longer.
Yeah, and this is again where, so much I think in older people, men and women, a lot of their health issues really have so much in common, but definitely these fractures and fragility fractures, we really are very concerned about, like thin, old females. If you're a tobacco smoker, I always think of my grandmother with osteoporosis risk because she was just as set up in all of those. So yeah, and this is where calcium and having some dairy in your diet can be kind of protective. Doing some weight-bearing exercise, we're always in favor of that. Lift some weights, pump some iron, ladies.
Very important.
Yes. And then a lot of the other kind of health screening we talk about are pretty similar for men and women. Colon cancer screening, getting your vaccines updated, kind of blood pressure, cholesterol type stuff. I mean, there's some differences and some nuances and risk for men and women, particularly heart stuff, but don't forget about it. It'll find you. All right. So I think we've talked about the entire life cycle.
I do too.
Way to go.
What did we miss?
This has been an overview of the human condition. What else, Andrew? What else did we miss that we ought to talk about?
I want to say something, but I know we can't edit this, so in case it doesn't hit. Have we talked much about mental health? I'm not saying you ladies all need it, but Some do. It is an important topic. Obviously, I'm joking, but it's not. It's a serious topic. But I don't. I don't think we touched on that maybe as much.
Yeah, I think. Okay, so this idea of more screening for depression, anxiety, more recognition that it exists definitely is there. I mean, one place that we screen women a lot is during pregnancy. Like we're really trying to do some aggressive screening for depression, during pregnancy and after. But yeah, I mean, I think screening for these things, we just find it so frequently, wouldn't you say?
I would say, especially postpartum, I think it is really prevalent. I think you see a lot of depression, but also anxiety after having a baby. I mean, postpartum is just a really isolating time. I mean, I think we talk a lot to the moms while they're pregnant, and then the baby's born, and then it's all about the baby, and then it's kind of like everyone kind of forgets about the mom a little bit. But it really is that fourth trimester, and it's a doozy at times. Yeah.
I think as a dad, you can also kind of relate to that, just like, that the focus is totally on the kid, and kind of your experience as an adult becomes like, I always remember this with teen parents, like you go from a poor kid to an irresponsible teen parent with like one pregnancy. But,
yeah, and you just think about it, there's, at least for us, there's a flurry of activity those first 2 weeks home, right? And then I was never one to take off too much time, but the mothers and mother-in-laws, they stepped in and stayed. But then after that 2 weeks, especially with that first one, it's just mom home alone for 8, 9, 10 hours trying to figure out the whole raising a child thing. An infant.
Yeah.
But,
and it's supposed to be like, oh, how wonderful. So there's all this kind of expectation that you'll be so wonderful, and you're kind of like, I feel like I'm in baby prison.
Yeah.
I remember thinking that, like, I need to talk to an adult.
And your body's different. I always thought that was hard. Like, it's just, everything was different.
Somebody told me once, getting married is a big change, but having a kid is a really big change.
Absolutely.
Oh, man. Yeah. I think in women's health. I mean, just that whole idea of like making the next generation, that's a huge thing, I think, in all of our lives. And we've kind of talked about it in so many ways as we discuss women's health. But
yeah, and I think maybe just thinking about the life cycle again, something new that, probably the generation of physicians before you guys didn't have to deal with would be like the effects of social media on young girls' mental health and things like that. And I know that's something that I worry about, having a daughter getting close to her teenage years and what that looks like. But that's a whole nother ball game as well. And fragile time, I think, for girls in general. And then you have social media that amplifies everything. So
Everything. Yeah.
Yeah, and just all of this kind of pressure to look a certain way and be a certain way. And we're born with the bodies we're born with. And
Right.
I don't know, this idea that, change it or be something else. I don't know, I'm always trying to encourage people, like, this is your body, you got it your whole life, just, exercise and be strong. Because, trying to be something else and these pressures to change, those are tough ones.
Yeah.
Anybody have an answer to that?
Get rid of it. I mean, that'd be great.
that would be great.
Oh, that'd be so nice.
Turn it all off.
Yes.
Pull the plug.
But where would I find all my funny memes?
I mean, that is true.
Where would you listen to podcasts like this?
You're right.
I guess we don't need a screen for that.
Yeah.
But anyway. Well, Kayla Knauss, thank you so much for coming and chatting with us. Any other major women's health things?
I don't think so.
I just really appreciate you coming and talking with us and what you do in clinic. And, I would say we've touched on some things, but this is a huge topic. And I think especially people end up having specific questions, and that's where I'd come in and talk to somebody. I mean, make an appointment here with somebody at Gothenburg Health or wherever you get healthcare, wherever you feel comfortable. But, don't suffer alone on some of this stuff.
Absolutely.
Yep. People care about you, even if you don't have a deep personal relationship with them. There's plenty of people out there that you can connect with and find hope. So
Yeah. And I think especially on stuff like this, in public we don't talk about it a lot, but in the clinic we talk about this stuff a lot. And this is a big part of, I think, what we do as family docs is kind of helping people through some of this stuff. And it makes it a fun place to be.
Absolutely.
all right. Well, thank you guys. Thanks for not being too hard on me here. And
You did a good job,
You did great.
Andrew.
thanks. All right.
All right.
Thanks, everybody.